All right, so here's the deal. My girlfriend got COVID. We have no idea how. And somehow I didn't get it. And we have no idea how. So I've been waiting to tell this story because I really wanted to be sure I didn't get it. And I wanted to be able to tell you the full story with some definition. So this now goes back a period of time, but I'm going to lay it out for you the way that that it all is. Let's call it. I'll just use day numbers. Okay. Day 1, she wakes up with a sore throat. We say, uh-oh, let's see what's going on. We both take rapid tests and are both negative. And we just hang out at home for the remainder of that day. By the end of the day, she's feeling fine. Wakes up on day 2, says, my symptoms are gone. Had a sore throat. It's gone. I'm feeling fine on day 2. End of day 2, she says, I think I'm still feeling fine, but I don't know. I'm just really weirdly tired. I don't know, a little bit of a headache. Okay. We go to day 3. Wakes up. She says, my sore throat is back. I'm feeling worse. I've got a headache. Let's go and actually get PCRs. Go get PCR tests, told, it's going to be 24 to 48 hours before you get the result. Later on day 3, she develops a fever. So now we've got sore throat and fever and a little bit of headache. I feel fine. We're waiting on the PCR results, but she's got fever. We go to day 4. Day 4 still has fever, using Tylenol to manage it. I still feel fine. Now, at this point, we're assuming this actually could be COVID. Maybe the rapid test on day 1 was just too early. Day 4, we get the PCR back and it says negative. Everybody's still negative. Now, that was taken on day 3, what would be considered day 3 of symptoms. Day 2, the symptoms went away, but it's probably day 3 of symptoms. PCR is still negative. Day 4 still has a fever. Fever starts climbing, 101, 102. I still feel fine. Because she has the negative PCR, I'm thinking, well, this is something else. We don't really have to worry. We're sharing a thermometer. We're sharing food. We are, I drove her in the car to get the PCR tests. We're sleeping in the same bed. Okay, day 4, fever is still there. Day 4 at night, the fever seems to go away. Day 5, she wakes up. I still feel fine. She wakes up and she says, my fever's gone. I'm less feeling like I'm sick. My throat is about 50% better. Maybe it's going away. All right, fair enough. But then on day 5, she develops a cough. And it's not a good cough. This is the cough. It's what would be called in the industry a productive cough. It's a bad cough. I still feel fine, other than at this point, I'm having what I would, some people call it a phantom headache and sore throat. Some people would call it a Jewish neuroticism headache and sore throat. Some of you will understand what that means. But I don't really have symptoms, but I'm kind of like, do I feel something? So now we're on day 5. And because we, still getting negative COVID tests, negative PCR, negative, the sore throat, she says, could this be strep? Could this be flu? Fever's gone, sore throat, that productive cough is here. So we say, well, we need to get a flu test and we need to get a strep test. I'm still feeling fine. We're not isolating. We're in the car, driving to get the strep and flu, et cetera, et cetera. She gets tested for everything. Day 5 at night, gets a call back and they did another PCR just to be sure. They test for RSV, other viruses, flu, strep, et cetera. They say, ma'am, you're negative for everything except COVID. You have COVID. And she says, really? I had, multiple negative rapids, negative PCR, et cetera, et cetera. They say, no, it's definitely COVID. And you should be, she says, do I need to isolate from my partner, my boyfriend? We live together. And the doctor says, yeah, you really should. So at that point, I'm just kind of thinking, if I didn't get it yet, I'm not going to get it, right? But day 5, you can still be contagious, even though she's had 24 hours without a fever. And this is where it kind of gets to these mixed messages. We have the new CDC guidance and the old CDC guidance. If you're without fever for 24 hours and it's been 5 days. In theory, you're all good, but are you really? Do we know? What about Omicron? All this different stuff. So we start isolating, and we isolate for 3 days, sleep in separate rooms, and, wear masks in the house when we pass each other. I really don't want to get this thing. And okay, I had 5 days of exposure, day after day after day, sharing food, sharing thermometers, sharing but we'll just isolate for the 2-3 additional days. At that point, she gets to day 9 and still has the nagging cough, but is otherwise mostly better. And at that point, I say, I think I beat it. I think with the 3 doses, clearly I was exposed. I was exposed in the 2 days before she was symptom. In theory, I was exposed on day -1 and 0, because that's when you're believed to be most contagious. And I was exposed on days 1, 2, and 3, when you're believed to be most contagious. And I was exposed on days 4 and 5, during which you're in general believed to be less. I just didn't get it. Now, could I have had an asymptomatic case? Yes, one that was both asymptomatic and was negative on rapid and PCR tests. Now, you might say, well, did you do subsequent PCR tests? I did. On day 7, we both did additional PCR testing. She was still positive. I was still negative. On day 9, we both did rapid tests. She was, we were both negative by that point in time. So I don't know. I don't have an explanation. I don't know that we will ever really get an answer, other than maybe it's as simple as the vaccine worked. The vaccine, which when you have 3 doses, even against Omicron, believed to be 75% effective against symptomatic disease. I mean, this was not passing exposure that I had, I think is the point I'm trying to make. We were in the car driving back and forth from testing into the hospital or the urgent care, whatever, the different places to get PCRs. And we were, in the same room and sharing food. I was clearly exposed. And apparently I had the neutralizing antibodies were activated, and I somehow ended up not getting sick. You hear about people across the hall from someone in a hotel isolating. One person has COVID. Nicholas Christakis told us about this story. The person across the hall gets it. It can be that contagious. I feel like I dodged a bullet. Somehow, 5 days of constant exposure, really 7 days, if you include the 2 days prior to symptoms, 7 straight days of full exposure. And I didn't get it. Unfortunately, because we both work from home, it didn't create any kind of disruption in terms of work or anything like that. But that's my story. And you now know everything I know. And the reason I kept waiting to tell the story was, in my head, I was like, okay, what if I tell the story now about how I didn't get it, and then somehow, like, she's still contagious on day 14, and then it incubates for 5 days, and I end up with it on day 19? These on the edges of the bell curve scenarios. It's now been long enough. It's been, 3 weeks that I'm feeling pretty good that if I were to get it now, it wouldn't be from that. Now, where did she get it? We have no idea. First of all, we basically both have been doing the exact same stuff. We go to the same places. We don't do any indoor dining. We're not going to the movie theater. We're not going to sporting events. We're not doing any of that stuff. We didn't really have any indoor unmasked contact with anybody other than a car ride with my brother, who also hadn't done anything, had no symptoms, had no positive tests before, after, or during. Is it possible that this is so contagious that some of those other means could potentially give you the virus? There was an instance where, when we were outdoor dining, she went into the restroom with a mask on. Could there have been a surface thing there? Grocery store. I mean, we really have no idea. And presumably, not only did I not get it from her, but we were both exposed to wherever she got it. And I still didn't get it. So I don't know, folks. I don't know. But it is very, very wild times. And that's the full story as I understand it right now.